Fasting, the willful refrainment of eating for a period of time. Most of us have been told that breakfast is the most important meal of the day and that we shouldn't go more than a few hours without eating. But is this really true? You might be surprised to hear that not eating for periods of time, aka fasting, actually has a lot of benefits. And that's what we're going to dive into today. Hey guys, welcome back to my channel. If you're new here, my name's Kate, I'm a health coach and I post videos on a high-fat, nutrient-dense way of eating. If you like this video, please give it a thumbs up, feel free to share, and make sure to subscribe. And make sure to follow me on Instagram, Twitter, and Facebook, where I share new posts every single day. As I mentioned at the start of this video, fasting is any period of time where you refrain from eating. Intermittent fasting pretty much just means that you have a fasting schedule. For example, probably the most popular variation is 16-8. You fast for 16 hours every day, you don't consume any food, and then you have all of your meals within an 8-hour window. There is also alternate day fasting where you eat one day and then fast the entire next day. But anyways, we're going to talk more about how to implement intermittent fasting into your lifestyle at the end of this video. But for right now, if you've never heard of or tried intermittent fasting, you might be thinking, why on earth would I want to do this? I'll tell you why. Benefit number one is that it stabilizes your blood sugar and improves insulin sensitivity. If you're diabetic, then you probably already know how important it is to manage your blood sugar, but this is something that should matter to everyone. Insulin resistance is when your cells start resisting or ignoring the signals that the hormone insulin is trying to send out. The way it is supposed to work is that as our blood sugar rises, our bodies produce insulin to transport it to our cells. When working correctly, this allows our blood sugar to remain stable. The reason this mechanism stops working is because it is overused. The good news is that if you have high blood sugar, are diabetic, or are insulin resistant, or are on your way to having any of these conditions, they can be reversed with fasting. By not eating for periods of time, you are giving your body a break from the cycle where your blood sugar rises, insulin is pumped out, and breaking out of this cycle, even just for periods of time, gives you a chance to become more insulin sensitive. In one study, all 3 patients who were type 2 diabetic eliminated their need for insulin by initiating a therapeutic fasting regime. All 3 patients succeeded within a month, and one in as little as 5 days. Benefit number 2 is increased production of human growth hormone. Human growth hormone is, as the name says, a hormone that promotes growth, but also cell reproduction and cell regeneration. It's naturally produced by the body, but remains active in the bloodstream for just a few minutes. Human growth hormone helps to maintain, build, and repair healthy tissue in the brain and other organs, and also helps speed up repair of injuries and muscle tissue after exercise. In one study, 14 men were randomized into 2 groups. One was given human growth hormone therapy and the other just a placebo. After 6 months, there was a statistically significant increase in leg press responsive muscles of those in the therapy group. But this doesn't just help with muscle gain and injury repair, it also helps with weight loss. Human growth hormone stimulates lipolysis, which is the breakdown of fat. And since we've now brought up weight loss, that is another benefit of fasting in and of itself. Now, there is no denying that in clinical studies, intermittent fasting has been shown to result in weight loss, but why exactly that is debated. Some people argue that those fasting only see weight loss because they end up eating less calories overall, basically the calories in, calories out theory, whereas others argue that it's due to other factors, some of which being decreased insulin and increased human growth hormone, which we've already talked about. Either way, fasting has been shown to not only accelerate weight loss, but all while maintaining lean muscle mass. Benefit number 4 is increased autophagy, leading to decreased disease risk and increased lifespan. Autophagy is the body's way of cleaning up old, damaged cells in order to regenerate new cells. It removes toxic proteins from the cells that are attributed to diseases, especially Alzheimer's and Parkinson's, and even cancer. The best way to produce autophagy is by fasting, although other things such as exercise and coffee have been shown to increase it as well. Benefit number 5 is that it improves digestion. This one is pretty straightforward. If you're not eating anything, there's nothing for your body to digest. It's kind of the same as we were talking about earlier with insulin. You're basically just giving your body a break. When you're constantly eating, your body is constantly having to process food. And now for the cons. Fasting diehards might say that there are no downsides to fasting, but that isn't entirely true. I'm not talking about claims that your body's starving or anything like that, but for certain people, in certain situations, fasting might not be ideal. Con number 1 is that it stresses your body. Fasting is a stress on the body. There's no denying that. But stress isn't always a bad thing. Exercise is a stress, for example. Short bursts of stress like this are beneficial. But if you're already stressed, if your cortisol is already high, then fasting might be adding too much to a glass that is already full. The key here is to not force it. Let periods of fasting fall into place naturally. I'll talk about this a little bit more at the end of the video. Con number 2 is that it can lead to nutrient deficiencies. Now, this one's tricky because I really do believe that you should only eat until satiety. But if you're doing 1 meal a day, which is a variation of intermittent fasting, it can be really hard to fit all of the nutrients your body needs into 1 meal. Short term, this isn't too much of a concern, but if you stick to a fasting schedule for, let's say, months or years, deficiencies can build up. And protein especially. One symptom some people experience when fasting is hair loss. And this really just comes down to not getting enough protein. This is one of the reasons why you want to make sure that the foods you are eating are all really nutrient dense. You don't want to be wasting your time with foods that are empty calories. I have another video on my channel that is the 5 nutrient dense foods that I eat every single day. You can check that one out after this one if you like. Con number 3 is that it can be used as a form of self-punishment. Now, this one really comes down to the individual and their history with food. For someone who has a history of binging, restricting, or any other sort of eating disorder, fasting can ultimately cause more harm than good. And those are the pros and cons of fasting. And now, if you're looking to implement intermittent fasting into your routine, here are some tips. Number 1, define your goal. Is it weight loss? Is it healing? Is it disease prevention? Or just general health? Know the reason why you want to fast. Decide if you need a strict schedule or can be more flexible. If you are someone with a lot of weight to lose or someone who struggles with moderation, then a strict fasting schedule with clearly defined eating and fasting windows might be a better option for you. Personally, I like to take a more flexible approach. Once you've been low carb or keto or carnivore for a while, fasting starts to come naturally. You aren't hungry when you wake up in the morning, so you can skip breakfast without a second thought. Generally, I fast from between 14 and 18 hours every day. If I wake up and I'm hungry earlier, then I'll have my first meal earlier. If I'm not hungry, I might push it later. But in the end, both strategies are effective. Number 3 is to stay hydrated and replenish electrolytes. During your fasting window, you should not be consuming any food or caloric drinks. Most experts agree that tea and black coffee are accepted during this window, so you can include those. Water is of course recommended. Dry fasting is a whole other topic for another day. But one really important thing that I have noticed to make such a difference is salting your water. I like to add a teaspoon or even 2 to my bottle of water if I'm doing a longer fast. And even if I'm not, I've started doing this pretty much every morning. And make sure to get a high quality salt. Don't just use table salt. Redmond's is one good option. And in terms of other electrolytes, sodium is really the only one you need to worry about, unless you're doing fasts longer than 24 hours, in which case you might want to add an electrolyte supplement that includes potassium and magnesium as well. Anyways, guys, that's all I have for you today. Let me know in the comments down below if you practice intermittent fasting and what your schedule looks like. Let me know down below, and I will see you next time. Bye, guys.